Hello and thanks for joining me. One of the most commonly heard phrases in the last 18 months is health advice. Health advice. The latest health advice. The best health advice. Well, what makes for good health advice? Yes, some of you might think that having come from the mouth of an expert, a medical expert, would be good grounds and reason for having good health advice. But this is not sufficient because there have been so many different narratives that have influenced the health advice. Ultimately, good health advice, hopefully, yes, comes from the mouth of an expert, but good health advice should also ultimately be based on the best science, which means there's an objective standard that measures or on which this health advice is based. So ultimately, we're looking at the truth. But we see that this is not always what the health advice is based off, or only a part of the truth. Let's see what's happened. In the case of the AstraZeneca in Australia, we were initially told that AstraZeneca is not safe for people under 40 because of the blood clotting. Yes, we're told it only happens in 6 cases in however many, very small figure. But nobody wants to be one of those 6 cases. Nobody wants to take a jab that's supposed to save their life and ends up taking it or making them very sick. Okay, so we all know that, and I hope we're all on the same page. But that was the initial health advice, that those under 40, it was unsafe to take the AstraZeneca jab. And then what happened? Well, blood clots were discovered in people in their 40s. So the health advice changed again. And then it was made so that people 50 and under, shouldn't be taking the AstraZeneca because of the fear of blood clots. So far, so good. The health advice seems to be reflecting on the objective data. That's the scientific method. Then cases of blood clot were discovered of people in their 50s. So now the health advice was changed yet again. People 60 and under should not take AstraZeneca because it was considered to be unsafe due to the risk of blood clotting. And then what happened? The health advice changed again, and now anyone 18 or over could take AstraZeneca. What has changed? Has the disease changed? Well, there's been a mutation, the Delta variant, but as we've discussed before on this channel, that it's not as deadly, nowhere near as deadly as the Alpha strain, even though it's between 50 to 55% more infectious. So the disease, apart from that, hasn't changed. Has human nature changed? No. Has the vaccine itself actually changed? No, it's still the AstraZeneca, the same vaccine that was produced. What has changed? The political narrative has changed. In other words, increasingly, the government is under more and more pressure to be looking to be doing something in an increasingly what seems like a desperate situation. But the desperate situation isn't really happening from people falling like flies. The number of deaths due to the Delta strain are way less than the number who died due to the Alpha variant. So that's not what's happening. And so what we see is that the medical advice, the health advice, is being modified to suit the political narrative. This is not following good science. This is bad science. And this is why then, understandably, many people can question the reliability of such health advice. If it's not based on objective science and ultimately on the truth, then it should be treated with more than a pinch of salt, and I understand people's hesitation in wanting to receive such a vaccine if they don't feel it is completely safe for them. And I say this as someone who actually thinks vaccination has done a tremendous amount of good for the human race in the last 225 years in which it has been in existence, really. Let's take it on a bigger scale, the international scale, with Pfizer, the other vaccine. It has been touted now for some time that the efficacy for the immunity will wane after about 6 months. But this year, or this week rather, the FDA, the Food and Drug Administration in the United States, the equivalent of our TGA, the Therapeutic Goods Administration here in Australia, the FDA wanted to approve it as a fully approved vaccine. well within the 2-year time limit for the clinical trial that it was under. And yet various other medical journals, and in particular I'm referring to the opinion piece written on the 23rd of August in the British Medical Journal, which is a very prestigious medical journal viewed or read by scientists and medical practitioners the world over. And they were simply raising various questions and asking questions that the data on which the Pfizer latest announcements were made, the cutoff was the 13th of March of this year, a time when the Delta variant had not yet hit the United States. And yet it's still proposing the Pfizer as a very comfortable and high level of vaccination and of safety, of immunity. Meanwhile, in Israel, they've published recently, very recently, some figures saying that by early July, so most of the people in Israel were vaccinated using the Pfizer vaccine, that by early July, the vaccination level or the tolerance, the immunity was at 64%. By the end of July, it had dropped to 39%, a 25% drop in 1 month. So clearly the effectiveness of the vaccine is waning, and that's why they're considering doing a third shot. But why the great hurry to push a vaccine through when in fact the full science hasn't yet been discovered, hasn't yet been tested thoroughly enough? And that's what the opinion piece was saying there by one of the lead senior editors in the British Medical Journal on the 23rd of August of 2021, saying, slow down, let's do this right. But a word from St. Paul here, the love of money is the root of all evil. Have you wondered how much money a company like Pfizer stands to make, say within this year alone? Somewhere in the order of $33.5 billion US dollars, 2.1 something billion doses. When that kind of money is at stake, you understand why certain details of the truth and of science perhaps are kept behind. You might like to think, well, it's sloppy at best, but it's actually something very scary at worst. And so I invite you, don't accept something uncritically just because it's said by some pharmaceutical company, or just because it's approved by the FDA or the TGA, or said by some chief health officer or some politician. Scrutinize. Don't check your brains out. Keep them engaged. Ask questions. Look up things online. Look up scientific papers and journals. Ask questions, and don't stop asking until you get answers. Because health advice ultimately, ideally, should be based on the objective science and on the truth, and not as a convenient way to coerce people through fear to receiving something, a jab, that may not be 100% safe, despite what everyone or the official authorities might be saying to you. The science will decide what is safe or not safe. So I understand why some people have a hesitation about receiving a particular vaccination, and that's why I've said on a previous video that ultimately, while vaccination is a good thing, it must be received conscientiously, with freedom of conscience, and with a reassurance that there's a high degree of safety. And if you have questions, then keep asking until you get the answers. Thank you for joining me. If you like this video, please like and subscribe, and I look forward to seeing you again in the next video.